In honor of the International Day of the Midwife, Friends of Michigan Midwives and the Michigan Midwives Association bring you this series of 3 short videos about Michigan licensed midwives. We hope these videos will help the viewer to understand the LM license and the CPM credential, and how this profession serves Michigan families who choose out-of-hospital birth. Part 3 provides answers to questions frequently asked about licensed midwives. Whose questions are these? Yours. These are questions about licensed midwives that advocates have been asked often by legislators and staffers. Question 1. What is a midwife? Let's start right at the beginning. A midwife is a person trained to assist women in childbirth. Interesting fact, midwives attend 80% of all births around the world, but only about 10% of U.S. births. Question 2. What is a licensed midwife? Here's a quick refresher from part 1 of our video series. A Michigan licensed midwife, an LM, is someone who practices midwifery, which is defined in Part 171 of the Public Health Code as providing maternity care that is consistent with a midwife's training, education, and experience to women and neonates during the antepartum, intrapartum, and postpartum periods. In other words, during pregnancy, during labor and birth, and for the 6 to 8 weeks after birth. Are LMs nurses? Question 3. Nurse midwives are a different kind of midwife. They are not LMs. While the 2 kinds of midwives share a similar approach to care, they are 2 separately licensed Michigan healthcare professions. Most nurse midwives practice in hospitals or physician practices. Occasionally, they attend births in homes or independent birth centers. We'll talk about birth centers soon. Michigan LMs, on the other hand, practice exclusively in homes and independent birth centers. They do not receive hospital privileges. Their scope of practice is for the childbearing year only, that is, the year surrounding pregnancy, and they are specially trained in out-of-hospital birth. So where do doulas fit in? They are not LMs either, but non-medical professionals who provide support to families before, during, and after birth. Question 4. Getting back to LMs. How unusual is it for a state to license this kind of midwife? Not at all. In fact, it's the norm. Right now, 36 states license certified professional midwives, a credential we'll discuss on the next slide. Michigan became state number 31 when our Licensure Act passed in 2016. Question 5. What is required to become a licensed midwife? Licenses are typically based on a certification. In this case, it's the Certified Professional Midwife credential. CPM candidates must complete a 3 to 5 year education that includes classroom instruction and clinical training, part of which is a lengthy practicum as a student midwife. They must also pass a 2-day exam. Question 6. Where do midwives attend school? Right now, in the absence of any Michigan brick-and-mortar schools, most attend schools in other states through remote learning and carry out apprenticeships locally with CPM-approved supervising instructors. As demand for midwifery education rises following the establishment of licensure, community colleges might well begin to offer midwifery programs. Question 7. Where do licensed midwives practice? We've been referring to out-of-hospital birth, a shortcut that refers to birth in a family's home or in an independent birth center. Some LMs provide all prenatal care in their clients' homes, while others provide some or all prenatal care in their office. The most important thing to remember is that CPMs, so all Michigan LMs, are the only profession specifically trained in out-of-hospital birth. Question 9. Do licensed midwives ever practice in hospitals? Not usually. There's no legal reason they shouldn't, but hospitals in the U.S. rarely offer employment or privileges to any midwives other than nurse midwives. In other countries like Canada, the equivalents of licensed midwives do practice in hospitals. Question 10. Do licensed midwives work with obstetricians? Well, it depends on how you define work with. LMs aren't supervised by OBs, since LMs are independent practitioners by both law and training. But LMs interface closely with OBs and other medical personnel when there is a transfer of care, at any time, whether during pregnancy, during labor and birth, or in the weeks after the birth. The administrative rules for LM practice include internationally recognized protocols for the transmission of patient information and other interactions between midwives and medical personnel. This is because integration of systems contributes greatly to the safety of out-of-hospital birth. At this point, it's also worth noting that, contrary to scenes in movies and TV shows, most transfers of care are non-emergent, even those carried out during labor. Question 11. What besides place of birth differentiates licensed midwife care from standard obstetrical care? LMs follow the midwife's model of care, which was defined in 1996 by several national midwife and consumer organizations. The model embraces extensive, nurturing, hands-on care before, during, and after birth. Midwives are healthcare professionals specializing in pregnancy and childbirth who develop a trusting relationship with their clients, which results in confident, supported labor and birth. All midwives are trained to provide comprehensive prenatal care and education, guide labor and birth, address complications, and care for newborns. The midwife's model of care is what makes midwives so effective at reducing the incidence of birth injury trauma and cesarean surgery, as well as in reducing disproportionately high rates of infant and maternal morbidity and mortality in communities of color, as demonstrated by the work of Jenny Joseph, Debbie Allen, and others. Question 12. We've used many terms for midwives in this video. Which are the best to use in referring to licensed midwives? Well, not surprisingly, we favor licensed midwife. That's the most accurate term for the midwives we discuss in this video. You can also use CPM, since it's the credential that LMs must hold. Out-of-hospital or community midwife are also good terms. They refer to any midwife who specializes in care given in homes or birth centers. Terms we don't recommend for referring to LMs: certified nurse midwife. There's nothing wrong with the term, it just refers to a different kind of midwife. We also don't recommend the term direct entry midwife because it's been used both to include and exclude CPMs. Finally, the term lay midwife is perceived as derogatory by most LMs because it suggests a lack of formal training and therefore disparages LM training and education, which, as we've shown a couple of slides back, is considerable. The next few slides deal with question 13. Is midwifery care safe? What, that's not enough for you? Okay, we'll elaborate. Many aspects of midwifery care contribute to its safety record. Licensed midwives care for low-risk pregnancies and are experts throughout pregnancy at both preventing complications and recognizing them early when they do occur. One of the hallmarks of LM care is the close relationships midwives foster with their clients and their clients' families. An LM is usually aware of clients' nutrition in great detail, family relationships, and any stressors in clients' lives. All this is possible because of in-depth prenatal appointments that last 45 minutes to an hour. Compare this with the length of medical prenatal appointments that range from 5 to 15 minutes. LMs are specifically trained in out-of-hospital birth and have special training for rare emergencies that require them to perform neonatal resuscitation or treat postpartum hemorrhage. Rules for LM practice specify the circumstances that require consultation, referral, or emergency transport. They also include a short list of pregnancy conditions that preclude an LM from taking on a client, such as active tuberculosis or chronic cardiac disease. As we mentioned earlier, the rules also incorporate protocols for transfer of care. Finally, just by reducing the number of non-medically indicated cesareans in low-risk populations, LMs substantially lower one of the largest causes of maternal morbidity and mortality. And there's data. This is just a small selection of the many safety studies that have been carried out around midwifery care and place of birth. Let us summarize some of the findings. For maternal and neonatal mortality and morbidity, midwives produce at least equivalent outcomes to OB-attended hospital births when comparing similar low-risk pregnancies. Their clients have a significantly reduced incidence of cesarean birth compared to similar low-risk pregnancies, and a similarly reduced incidence of forceps or vacuum delivery and of episiotomy, and a reduced incidence of preterm birth. In addition, their clients express greater satisfaction with their experience of birth. Midwifery care has become increasingly valued because it reduces the greater risk of bad outcomes in communities of color, and also because of the COVID-19 pandemic, as noted by the Association of Maternal and Child Health Programs. Question 14. How do costs for midwifery care stack up against costs for hospital birth? A midwife's fee for all prenatal care, labor and delivery care, and postpartum care is approximately equal to an obstetrician's delivery fee, somewhere between $2,000 and $6,000. The greater cost in hospital births is usually the facility fee. A home birth midwife does not charge an additional facility fee, of course. A birth center midwife charges only a small one. All this makes midwifery care a good value, particularly considering the greater amount of time midwives spend with their clients. However, because there is no robust mandate for healthcare insurance to cover LM care, many clients face paying out of pocket, where a hospital birth might be covered in full. And Michigan Medicaid does not cover LMs at all. However, this could change. Consider what happened in Washington State when it extended Medicaid coverage to LMs. A 2007 report found a yearly Medicaid cost savings of $1.6 million a year, and a combined savings to the healthcare system for cesarean reduction alone of $1.35 million a year. The savings for each out-of-hospital birth was almost $4,000, and this cost savings was achieved with CPMs attending just under 2% of births. Question 15. What's the situation with Michigan Medicaid? While it doesn't currently cover licensed midwife care, coverage could be added. Either if legislation were passed and signed requiring Medicaid reimbursement, or simply by policy decision of the Medical Services Administration. Question 16. We are often asked if licensed midwives are required by law to carry malpractice liability insurance. The answer is the same as for other healthcare providers. No. Other providers are often required by institutions or group practices to carry insurance, but not by law. Nevertheless, some licensed midwives do carry insurance. The rules for LM practice require disclosure to clients whether an LM carries such insurance. Question 17. What do consumers and midwives want in the future? We want more midwives. The demand for midwives continues to grow across the state. Rural areas particularly need more midwives. Urban areas, too, can use more midwives to serve diverse urban communities. These communities have expressed a desire to have midwives who look like us. We want more birth centers to facilitate out-of-hospital births for those families who cannot have births in their homes or who, for other reasons, would like a birth center birth. We want Medicaid coverage of licensed midwife practice so that this care can be accessible to everyone who wants it. Half of Michigan births are funded through Medicaid, so this coverage is a potential game changer for many Michigan families. Licensed midwives are passionate about the care they give, and consumers are passionate about the care they receive from LMs. This ends our video series on the Michigan Licensed Midwife. Thank you for watching. If you have questions, we urge you to email the address shown at the top of the screen. We wish you a happy International Day of the Midwife.